Good morning. If you are preparing for DM Neurology or DRNB Neurology for the DNB practicals or for the practical examination, this is a list of the cases which need to be prepared. So the cases which can come in the practicals are: number one is dementia, in which you can get any type of dementia, Alzheimer's disease, frontotemporal dementia, Alzheimer's variant. Okay. Second is cases of Parkinsonism. So typical Parkinsonism is less likely to come in exam, but it is the atypical Parkinsonism cases like MSA, PSP, CBD which will come. Then any patient presenting to you with chorea, with dystonia, myoclonus, then patient with tremor can be given in the exam for the short cases, and a myopathy case will come in a long case. In myopathy it will be the cases can be dystrophinopathy, LGMD, and then the inflammatory myopathy is a separate case. Myotonic dystrophy is also given as a case. Then in neuropathies we have the hereditary neuropathy, in which CMT, autoimmune neuropathies like CIDP, AIDP can be asked. Then the patients with cerebellar ataxia will come for evaluation, and in that cases, if spinocerebellar ataxia is a favorite case of the examiners, so approach to autosomal dominant cerebellar ataxia, autosomal recessive cerebellar ataxia, in which Friedreich ataxia is a main phenotype. These can be kept in the examination. Then a patient presenting to you with sensory ataxia, how to approach that patient. Then patients with myelopathy, both compressive, non-compressive, can be kept in the examination. Then sometimes stroke cases are also kept. In that case you have to examine the patient, and various brainstem syndromes can be asked related to it. Stroke syndromes is a favorite question. Then how to manage the patient, what is NIHS and MRS criteria. And in anti-onset disorders, motor neuron disease is also kept in the exam. Along with sometimes SMA can be kept. And in neuromuscular junction disorders, basically they will ask you about myasthenic crisis, LEMS, and myasthenia gravis. So this is a list of the cases which need to be prepared for the examination, practical examination.